So I'd like to welcome everyone to our electronic Board of Health meeting. And due to COVID-19 pandemic, regional councils practicing physical distancing and participating electronically. I would like to formally welcome Councillor Mike Mann, who is the alternative member for Cambridge, to his very first meeting. So welcome, Mike. Happy to have you aboard. I will now ask Leanne Wetzel, Deputy Clerk, to conduct the roll call.
Thank you, Chair Redmond. Chair Redmond.
Present.
Councillor Armstrong.
Present.
Councillor Clark.
Present.
Councillor Erb.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
Councillor Harris.
Present.
Councillor Jaworski.
Here.
Councillor Jowett.
Here.
Councillor Kiefer. We'll come back to him. Councillor Lorentz.
I'm here.
Councillor Mann.
Present.
Councillor Nowak.
Present.
Councillor Shantz. Councillor Strickland had given his regrets. Councillor Verbanovic.
Present.
And I will call again for Councillor Kiefer
Here.
and Councillor Shantz. I'm sure she'll join us momentarily, so all present except for Councillor Strickland, and Shantz will be joining us shortly.
Thank you very much, Leanne. I will now entertain a motion to reconvene an open session. This is moved by Councillor Galloway, seconded by Councillor Jowett, that we now reconvene in open. I would ask you to use your icons to vote yes or no. That is carried, colleagues. Thank you. I'd like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we will go to the business at hand, which is the COVID-19 provincial announcement, which was made earlier today. And I understand that we're going to be briefed by Diane Schofield and then Dr. Wong. So Diane, welcome. You have the floor.
Thank you, Chair Redmond. So today the province of Ontario announced further restrictions and public health measures to limit the spread of COVID-19 and COVID-19 variants. The details related to the increased measures announced today will be embedded within Regulation 8220 of the Reopening Ontario Act, and these updates generally do take place within 24 to 48 hours of an announcement. So what we know from the Premier's announcement today is that as of 12:01 a.m. on Saturday, the emergency declaration under the Emergency Management and Civil Protection Act will be, it will have an additional 2 weeks added to a total of 6 weeks. That would take us from the original date of May the 6th to approximately May the 20th. There will be closing of non-essential construction, including places like hotels and malls, were two examples provided today. There will be a decreased capacity of essential retail to 25% capacity relative to the location capacity. Prohibited outdoor gatherings with anyone outside of their household unless they live alone. All outdoor activities will be prohibited, including golf course activity, basketball and tennis courts are closed, and playgrounds will also be closed. An increased authority for police that would allow for requiring individuals to provide purpose for having left their home and requiring people to provide their home address will also take effect as of 12:01 a.m. on Saturday. So as of Monday, April the 19th, places of worship, funerals and weddings will be limited to 10 people. Work from home will be enforced in such office-related workplaces. The Ministry of Labour will have enforcement officers visiting such locations as law firms, and accounting firms to ensure that those that can work from home will be working from home. And as of April 19th, there will be checkpoints throughout the provincial borders with Manitoba and Quebec. Exemptions included there are for the transportation of goods, for medical reasons, work-related activities, and those activities related to exercising Indigenous treaty rights. The Premier also did allude to an increased vaccine distribution by 25% to various hotspots, but there are no specifics provided to this piece of information. That was all I had noted at this time.
Thank you very much, Diane. We'll now turn to Dr. Wong to fill in the rest of this news.
Thank you. I'm actually not going to provide any more information about the news that came from the Premier at 4. I am just going to provide a quick overview through a couple of graphs of our current situation in Waterloo region. It shouldn't take very long. So I'll just, if you go to the next slide, please. Thank you, Kathy. So just wanted to note that this is our situation in Waterloo region, our epi curve, and you can see that our cases have increased rapidly, and that now our cases are made up predominantly by the variants, which are shown in yellow color. So our weekly incidence rate has increased to approximately 100 cases per 100,000 per week. And in Ontario, the rate is, if you go to the next slide, that shows the Ontario rate in orange and the Waterloo region rate in blue. And the rate in Ontario is approximately 188 cases per 100,000 per week. So the situation in Ontario is very serious. If you could actually go to the next slide. This just shows the hospitalizations in Ontario and how they are climbing, and they are surpassing the peak that we saw even in the second wave. And then finally, the last slide, please. So I'll just end with the situation in Ontario is extremely serious. And the healthcare system's capacity is threatened. Cases, hospitalizations, and sadly deaths will continue to rise and rise quickly unless collectively we significantly reduce our mobility and limit our contacts even further. So to protect ourselves and each other, we all must stay at home as much as possible, minimize close contacts, and continue to follow all public health precautions diligently and consistently. They still work against the variants. They are effective, but because of the variants and the dominance of the variants, we have to keep up with those measures very consistently and very diligently. And of course, when it is our turn to please get the vaccine as soon as it's available to you. So in closing, let's protect each other. Please stay home, stay safe, save lives. Thank you.
Thank you, Dr. Wong. So any questions both for Diane or Dr. Wong? Councillor Galloway, please go ahead.
Madam Chair, this I think is for Diane. Diane, you indicated, and I listened to the news conference as well, that all outdoor activity was prohibited: golf, playgrounds, soccer fields, etc. But the one thing they did say that was, it seemed like they said was still acceptable, is outdoor exercise. So I think a lot of people are going to wonder whether or not that they could continue to go on their walks or on their bike rides or whatever outdoor exercise they do. So is it clear whether or not those activities are still acceptable vis-a-vis playgrounds, golf, soccer fields?
Diane?
Thanks for the yeah. Thank you, Madam Chair, and thank you, Councillor Galloway. based on the Premier's announcement, he did reiterate that it was safe to go for a walk and perform activities related to exercise. Again, we'll wait for the regulation and information related in the regulation to be provided. And as of again, Saturday at 12:01 a.m., it is the golf courses, playgrounds, tennis, and basketball courts that will be prohibiting any activity at those locations.
Councillor
I just think
Galloway?
it's important to clarify that and get whatever messages out to the public, because certainly people are doing a lot of walks and a lot of biking. So people will want to know whether or not that's still acceptable or not. Sounds like it is, but I guess we'll have to wait for the regulations. Thank you.
Thank you.
Thank you. Councillor Foxton, please go ahead.
And through you, Chair, to Dr. Wong, in clarification. So we've heard it today and several times, the Premier stating that having the vaccine is the only way to end this. So a lot of people that have the vaccine, I feel they may have a sense of security. I also feel that, as far as my knowledge, and you correct me, please, is that that's a false sense of security. I think I've heard it said that you may have less risk of getting COVID, but you may still be a carrier. And therefore, we must still follow the 3 rules. Wash hands, wear a mask, stay indoors, or as much as possible. Could you please clarify for that for all of us and the public as well, please?
Yes, no, thanks. Excellent questions, Councillor Foxton. So, yes, if you're vaccinated, your risk of becoming infected goes down significantly, but you could still become infected. That's probably a better term than carrier, which actually means something a little bit different. But people can use the word carrier in the public discourse just because it often, is associated with this concept that you could still have the virus in your system, but just not have symptoms. So there are people that are infected but don't have symptoms, and these people can still pass it to other people. So what we know about the vaccine is that it is all the vaccines that have been approved in Canada, so Pfizer, Moderna, AstraZeneca, they are excellent at reducing severe infections, hospitalizations, deaths, so the severe consequences of infection. But even though they're really good at reducing those types of effects, you can still get infected, you can still have mild infection, or you can still get infected and have no symptoms and still pass it to other people. Now, at some point, when the majority of people in our population are vaccinated, there's also going to be an effect such that the transmission overall of COVID and its variants will decrease. So, at that stage, we can look at reducing, restrictions, not taking them away right away, but reducing them, for example, among people that have been vaccinated. But we're not there yet because we haven't covered most people in our population with the vaccine yet. So for now, everyone, including those who have been vaccinated, need to continue, as you said, to wear masks, to socially distance, and to practice all the other precautions that's being asked of everyone. Because they still get infected, as you say, and pass it to other people.
Councillor Foxton, does that answer your question?
Yes, it does. Thank you, Dr. Wong.
Thank you. Councillor Jowett, please go ahead.
Thanks, Chair Redmond. I just wanted to clarify with the announcements today, Diane, if you can help me understand what kind of impact is this going to have on parks that have, like, GRCA was completely booked up within, I think, opening day within a week. So everyone thinks that, can you hear me okay? Sorry. Everyone thinks that they're going camping
Yeah, that's a great question. And again, I'll have to defer to details of the regulation once we have some updates, and then provide further guidance, I guess, through those organizations at that time.
Thank you for that. I appreciate that. It would have been a difficult question. I wasn't trying to put you on the spot. I was just thinking maybe you got something else out of it, but okay, thank you.
No, thank you.
So we'll take it under advisement, Councillor Jowett, and get back to you when it's been clarified. It's a good question. Councillor Verbanovich.
Thanks very much, Chair Redmond. I'm just wondering, and this is either for I guess Dr. Wang now, Dr. Wong rather, on the issue of what's allowed and not, and I too get we don't have full clarity yet, but for those who are watching tonight, is it fair to say that it seems in terms of outdoor amenities, we've essentially gone back to the rules as they existed in the spring of last year? So i.e. nothing, no use of outdoor facilities where, touch and spread become a possibility, but the walking and so on are fine. I think that just gives people a sense of what it might, what it feels like, or what the rules actually mean this time around.
Yeah, really, the purpose of the strengthened measures really is to reduce mobility, is to reduce congregation, reduce the possibility for people to gather, and really send the message that people should only really go out when it's absolutely essential to do so. So the Premier did make a comment, I believe, about how, we have seen playgrounds be pretty full, and, this is something we need to try to reduce in general, not just in playgrounds, but in general, in that we don't want people really to congregate, even if, they are keeping a distance most times, because you're just increasing people's mobility and people's chances of, coming into close contact with each other and potentially spreading it. So you're really wanting to overall have people limit their mobility and their contact with others outside their households as much as possible. So we'll have to see the exact specifics of the regulations, to see what exactly is like everything that's like closed to be exact. But that is my understanding of why things like playgrounds have been closed.
And Dr. Wong, I know, some individuals struggle with this. I mean, we've all heard from them, those who choose not to wear masks or think, this is excessive. But this really is, I think it's fair to say, yes, we all have individual rights in a society like ours, but we also have a collective responsibility towards each other. And if I've correctly heard you and correctly heard others today, the real message today is about our collective responsibility to look out for each other. And the only way we're going to get through this and the challenging numbers that we're dealing with is by recognizing that and doing the right thing, so that hopefully we will be able to enjoy some of the summer going forward. Is that fair?
Yes, and you're absolutely right. That is the message that the province wants to send. We have to go back to a time where the streets were almost empty, like during the first wave. We have seen provincial mobility data now that shows when the province enacted the stay at home in early January, there was a significant drop in mobility that helped really bring cases down, 2 or 3 weeks or 4 weeks after that measure was put in place. But the situation in Ontario now is such that even with the stay-at-home order that they had enacted last week, the modeling is showing, that the cases are climbing more than they have ever climbed, even in the second wave, and are expected to exceed by much more in the coming weeks if nothing changes. So they had to make this change in order to try to move our overall collective mobility back to something close to when we were in the first wave and the streets were nearly empty. That's, like you said, Mayor Verbanovic, that what we all have to pitch in to do together, because the situation is so serious in Ontario right now. We don't have any other choice. Yeah.
Councillor Verbanovic?
But yeah, my last question is just in terms of our hospitals and so on. How are they managing in terms of the, we're seeing obviously the uptick, but our capacities locally not at the breaking point yet, like they are in some other municipalities? Are we seeing an influx of folks being transferred here yet, or is the capacity still here for our own folks if we need them?
Our hospitals are still managing, but that said, as Mr. Lochner has said before, the hospitals now have been directed, to really make sure that they operate as a system across Ontario. So there's patients in Toronto that are being sent to Ottawa even because they need to have beds for these patients. And we have started to see increases in our local hospitals from out-of-town patients where, where in their areas, the hospitals have been overwhelmed. And so our hospitals will be under increasing pressure, both from the cases that will end up in hospital from our own recent rise in cases, as well as the cases that are coming in right now from other areas. Our hospitals are excellent, and I'm sure they'll continue to do their best to manage, but it is that's another reason that it's a very concerning situation, even if right now our hospitals are still, able to manage.
Great. Thank you very much for all of the work you and your team continue to do. It's much appreciated.
I believe Mr. Lochner is going to add to that last question and comment. Mr. Lochner?
Thank you, Chair Redmond. Councillor Verbanovic, to your question, I really appreciate the call that you made and the points that you were making about this being a community effort. It may not look like it now, but with the cases doubling or tripling or quadrupling, when we look at the modeling of up to 18,000 cases and we're at 4,000 and some today, this can turn into a very different story in a matter of weeks. And as Dr. Wong has pointed out, the pressure on our hospitals now is pretty intense. When you double or triple cases, that will change in a hurry. So I really appreciate your comments earlier when people are asking, why me? What can I do as an individual? How will me staying home or changing my behavior for the next few weeks impact anyone? It may not impact you directly, but to your point earlier, it will impact so many people in the community who may need hospital care.
Thanks.
Councillor Clark.
Thanks, Chair Redmond. This is a question for Ms. Schofield, I expect, and it has to do with the regulation, so you may not know that yet. Essential construction. We have a number of affordable housing projects that are in various stages of development right now, including on our own properties as well as others that our partners are delivering. Do those projects proceed? Are they considered essential, or do we have to stop those as well?
Unfortunately, again, I'll have to defer to eagerly anticipating the release of the regulation, and hopefully there will be some clarification on what is essential as part of the list as released by the province.
We'll keep our fingers crossed.
Sorry, thanks.
And as I was writing down what the Premier was saying, he did give references to non-essential construction, but he did reference homes, long-term care, and hospitals as essential, Councillor Clark. So clearly the regs will spell it out, but it did look like we might get under the wire on that one. Do you have any further questions?
No, thank you.
Okay, thank you. Councillor Kiefer, please go ahead.
Thank you, Madam Chair. I believe this would be for clarification. Ms. Schofield, if she could answer it, I'm not sure. She may not be able to either, but here goes. Golf courses are shut down, but as we all know, some golf courses have takeout operations for food and that. Will that still be carried on or can be carried on?
Apologies. Thank you, Councillor Kiefer. I'll have to get back to you on an answer with that. I at this time don't have any clarification on any of the fine details as per the announcement today, unfortunately.
Okay, thank you.
Councillor Mann, please go ahead.
Thank you, Madam Chair, and through you. And this might be for clarification. I know it was touched on earlier, and we talk about parks and playgrounds, but what about parks and trails? And we have a lot of people who have visited the trails, and that becomes their favorite place to walk. And the ring roads in our parks are another favorite place. And I know the question is going to come: can I still walk in the park? And so I just ask for some clarification, if you can, in relation to that, please. Ms.
Schofield?
Yeah, yes, again, similar to the follow-up on Councillor Galloway's question, we'll endeavor to get some clarification on those pieces as soon as possible. But I will just make note that the Premier did, in his announcement, make note that, you know, he encourages people to get outside for walks, etc. There was some clarity around what was closed from a service provision for golf courses, etc. But we will get some details and provide information back to everybody, if that's okay.
Thank you for that. And if I may, Madam Chair, I think we can look at this and say that for the next 5 weeks, we really need to knuckle down and do the responsible and the right thing. And you can look at it and say, yes, it's 5 more weeks, only 5 more weeks that we have to do this. And if we do it right, we can get out of this predicament. And I think it's incumbent on all of us to make sure that we tell the public that it's only for 5 more weeks. So
Thank you, Councillor Mann. Councillor Harris, I saw your hand up and it doesn't appear still up. Did you want to make a comment or have a question?
I guess just a comment. I was pretty clear on hearing the Minister of Labour, Monty McNaughton, talk about the fact that residential construction, including home building, would remain active and open. And so to Councillor Clark's question, our affordable housing projects would be deemed essential, therefore they can continue operations, but that'll be laid out in the reg once it's published. I know the release is now out, so waiting for the reg.
Thank you, Councillor Harris. Councillor Foxton.
Sorry about that, trying to get unmuted. Yeah, I was just reading also some of the stuff is coming through from AMO on that. For those listening, that's the Association of Municipalities of Ontario. So they're reenacting the emergency childcare for essential workers again. So it does sound an awful lot like what we were in previously, some time ago, last spring? And so I just wanted to mention that in passing.
Thank you, Councillor Foxton. Are there any further questions? So, Ms. Schofield, I know you took yourself off screen. I just want to thank you very much for being our rapid note taker and listening intently as we waited for that update. So it's very helpful. Thank you very much. And Dr. Wong, I don't know if you want to make any more comments. There's an awful lot that is yet to be revealed. I know the Premier talked about mobility limits, enforcement, and vaccines. And some of the comments that he made about vaccines, I will await to hear what impacts, if any, that has on our supply as we go forward.
Yes. So based on what we heard at the press conference, it looks like that the province is planning to send more vaccine to areas in Ontario that have the highest number of hotspots. We will see how that translates in terms of our supply, but we are not an area that would have many hotspots. We have one provincial hotspot. We have sent out information about our 5 neighborhoods, but in terms of the province, they are looking at the first 3 digits of the postal code, and we have one of those, N2C. We also did learn through the news that it looks like Pfizer deliveries may be increased or will be increased in the month of May. So those factors, will affect our supply, and so we'll have to, await the actual confirmations from the province about how they'll affect our supply. But in the meantime, as Councillor Verbanovic said, we're not going to get through this unless we all pull together. We really need our residents to abide by the public health measures as best as they can, because it is the best chance that we have to get through this wave as quickly as we can and with the least damage that we can. And I want to thank residents for all that they've done to date, and for what I know they're going to continue to do to pull us through this. So thank you.
Thank you, Dr. Wong. I see Councillor Rent's hand up. Councillor Rent's comment or question?
Both. Thank you. Today, there was a lot of finger pointing between different levels of government, and I think people are very confused. I know I'm confused. I agree, Dr. Wong. There was an announcement that we're not getting some, and then 10 minutes later, we're buying 6 million doses, and it's just really confusing. And I'm wondering if there's some way where we can kind of track this and get real-time information so we know what's going on, because it's really upsetting to see different levels of government arguing about it and starting pointing fingers, and it usually happens after the deed is done. But I don't know if in the next week or so, are we going to have a shortage? Are we going to have to close down centers again? Do we have any inside information on that? Do we know if everything's going to stay the way it's planned, or are they really going to start taking away some vaccines from our area for other areas?
Yeah, so no, that's a good question. And so every Friday morning, Deputy Hilton, and this morning Inspector Davis give an update about that. What we do know is that Canada is dealing with a delay in the shipment of Moderna, which will mean that we're not going to get the doses that we expected for a couple of weeks. And we also know at this point in time that our shipments of Pfizer will be reduced in the month of May. So because of those two factors, what Inspector Davis announced this morning is that it's planned that we will have to close clinics in the future due to insufficient supply. Now, how the increased doses of Pfizer that were just announced by Prime Minister Trudeau, as well as the further rerouting of vaccine to places like Toronto and Peel, how that will factor into our local allocations has yet to be seen. So if there are changes to that, we will definitely keep the board informed and the public informed.
Thank you, Dr. Wong. And just for a point of clarification, when we talk about clinics being closed, what we mean is there will be fewer days
Yes.
but they'll continue to operate. And this is done in an effort to make sure that any vaccine that we have goes out of the freezer and into arms. So clinics will still be open, but they will be reduced days available to book appointments, correct?
Yes, that's correct. Thank you for that clarification. Very important.
So seeing no further comments or questions, colleagues, thank you very much for being flexible, for coming on very short notice. And looks like Councillor Galloway's holding something up. What are you saying, Councillor Galloway? Are you saying thank you?
Thank you. My thank you volunteer card.
That's next week.
I think it is.
Okay, good guys, but we're going to do this next week. But thank you. And thank you, Dr. Wong, to you and the legion of people that are working so hard. So with no further ado, we will now adjourn. And this is moved by Councillor Foxton and seconded by Councillor Kiefer. Please use your icons to vote yes or no. And that is carried. Thank you, colleagues. Everybody stay safe. Have a great weekend. And again, thank you for your attention.
We all need to practice that party of one.
Thank you.
Thank you.